Welcome to our video about fungal eye infections. What you need to know about fungal eye infections. If you want to learn more about fungal eye infections, then you have come to the right place. Read on to find out the symptoms of fungal eye infections, the cause of this condition, and how to get rid of them. You can also learn how to spread the infection. Read on to discover what it is and how it spreads. So you know the symptoms, what to do and what to avoid, and how to treat it. What are fungal eye infections? What is a fungal eye infection? Treatment depends on the type of fungus and which part of the eye is infected. Treatment for a mild infection may only involve using antifungal eye drops, but for a more serious infection, an eye doctor may prescribe an oral antifungal medication delivered directly into the eye. In the worst case, surgery may be necessary. A fungal infection can be extremely painful, and it can also lead to further complications, including vision loss and eye scarring. The cause of fungal eye infection is unknown, but exposure to fungi is common in river valleys. People who are exposed to fungi may contract histoplasmosis, which is a fungus that causes inflammation of the eye. Exposure to histoplasmosis is most common in river valleys around the world, with more cases occurring in the US and Canada than in any other country. People with compromised immune systems are also susceptible to histoplasmosis. Fusarium species are the most common cause of fungal eye infection and can be found in plants, water, and soil. Fungal keratitis can occur after an injury to the cornea. It is more common in people with a poor immune system, contact lens wearers, and those on corticosteroid medication. The most important way to prevent fungal eye infections is to get regular eye exams. Fungal eye infection symptoms. Fungus infection in the eye can cause a variety of uncomfortable symptoms. The eye can become inflamed and painful, and symptoms may vary from person to person. Fortunately, most fungal infections aren't contagious, and treatment is straightforward. If you've suffered an injury to the eye or rubbed plant materials against it, you may have contracted STI. It is also possible to contract a fungus infection through improperly cleaning contacts or from touching doorknobs. Treatment for a fungal infection involves taking an oral or topical medication for weeks or months. Topical antifungal medications, such as natamycin, are the most common treatments for eye infections. These medications target fungi in the eye's outer layer, such as Aspergillus and Fusarium. More serious infections may require fluconazole, amphotericin B, or voriconazole. The symptoms of a fungal infection may be similar to those of a bacteria or virus infection. In any case, treatment should be started as soon as possible. To identify a fungal infection, a doctor will take a detailed medical history and perform an eye examination. A tiny sample of fluid or tissue from the eye may be sent to a lab for a culture test. A fungus can be identified by this culture, and proper treatment can begin. About fungal eye infections. Infections of the eye may be caused by many different organisms, but fungal eye infections are among the most serious. These infections affect different parts of the eye, including the cornea, eyelids, and iris. Fungi infect the eye in two main ways: exogenous endophthalmitis, in which fungal spores enter the eye from outside, and endogenous endophthalmitis, when an infectious disease or parasite invades the eye through the bloodstream. It is important to know that a fungal eye infection can lead to more serious complications if not diagnosed promptly. While it is not contagious, it can be hard to distinguish from another eye infection. The treatment for fungal eye infections is often antifungal medications, either in the form of a topical preparation or as an oral medication. Surgical treatment may also be required if the symptoms persist or do not clear up within a few months. Although fungal eye infections are uncommon, if they go undiagnosed and untreated, they can lead to permanent vision loss or even blindness. While these infections are relatively rare, they can become dangerous if not treated promptly. Fortunately, the treatments are relatively inexpensive and simple. Those with a fungal infection should visit their doctor immediately. Symptoms can often develop over a period of time, but if left untreated, they may progress to a corneal transplant. How fungal eye infection spreads. Several microorganisms can cause eye infections. Fungi, on the other hand, cause infections of the eye. This infection is quite serious and can lead to permanent vision problems and even blindness if left untreated. There are two types of eye infections caused by fungi: endogenous, from outside the body, and exogenous, from within the body. Endogenous endophthalmitis occurs when fungal spores enter the eye from other sources, while exogenous endophthalmitis occurs when the infection spreads from the bloodstream to one or both eyes. The pathogenesis of fungal eye infection is complex. During the early stages, the infection may be localized, or it may spread to other parts of the body. Symptoms of endophthalmitis include a dark spot in the visual field and a blood culture that yields C. albicans. The affected eye must be examined closely to confirm the diagnosis. A history of eye infections, a thorough eye examination, and a diagnosis of the fungus may reveal some clues as to the pathogenesis of the disease. Another type of eye infection caused by fungus is histoplasmosis. While the cause of fungal eye infection is unknown, it is common in some forms of sexually transmitted diseases, such as the herpes simplex virus. To prevent this infection from spreading to another person, it is important to avoid touching the eye of a herpes simplex patient. Always wash your hands thoroughly before touching your eyes, and avoid sharing towels, pillowcases, and makeup with those who have this infection. Fungal eye infections diagnosis. Fungal eye infections are common and can cause ocular discomfort. It is important to find a medical professional to diagnose these infections as quickly as possible. While symptoms of fungal eye infections are similar to those of other infections such as a virus or bacterial infection, they should be treated immediately. Fungal eye infections can be caused by several different types of bacteria and fungi, such as Aspergillus, which can be contracted indoors and outdoors. In addition, patients can contract this condition from plant material, which may be contaminated with fungi. The most common site for fungal eye infections is the cornea. These infections can lead to keratitis, hypopyon, and corneal perforation, depending on the type of fungi responsible for the infection. A fungal corneal ulcer may present with raised slough, feathery margins, or colored infiltrates, although the presence of these symptoms is not always indicative of a fungal eye infection. The first step in the diagnosis process is to take a culture of the infected eye. A sample of the eyelid is usually a corneal scraping, but some patients have erythema or little blisters on their eyelids. A culture of the infection may also be obtained through smear or culture. For example, in a study of 219 keratitis cases, Candida was responsible for 5.4% of surgical trauma and 36% of corneal ulcers. Fungal eye infections treatment. Treating fungal eye infections is a difficult challenge. Effective antifungal drug administration is essential to achieve a full therapeutic response. This script outlines the main antifungal drugs and their concentrations and routes of administration. During an examination, an ophthalmologist should also discuss the patient's tolerance to antifungal treatments. Fungal eye infections are the most common cause of vision loss. In some cases, trauma or intraocular surgery can lead to fungal endophthalmitis. Ophthalmologists have experience treating these infections. They should be well versed in treating fungal eye infections. In patients with mixed infections, the best treatment is a combination of the two. In some cases, no treatment is required. In other cases, ophthalmology professionals must decide if a new therapy is necessary. For this reason, follow-up examinations should be scheduled. Follow-up examinations should assess the patient's response to the therapy and any complications. Treatment for fungal eye infections must be individualized based on the type of fungus found in the eyes. The prevalence of these infections is higher in warm climates than in colder regions. While the cause of fungal eye infections remains unknown, the most common culprit is Candida. The vast majority of cases occur in immunocompromised individuals. Treatment options are limited due to the difficulty of early diagnosis and the ineffectiveness of most systemic antifungals. Risk and prevention of fungal eye infections. The best way to prevent fungal eye infections is to keep your eyes clean and dry. Fungi thrive in damp, dark areas and can breed in leaks and dripping pipes. If you do not have regular eye exams, your infection may progress before you notice symptoms. Therefore, it is important to take preventative measures and schedule a regular checkup with your eye doctor. Moreover, you should avoid touching your eye with your fingers and make sure to wash your hands thoroughly. The most effective way to prevent fungal eye infections is to wear protective eyewear, especially when working outdoors. Also, wear protective eyewear when wearing contact lenses and care for them properly. The CDC offers a helpful guide on healthy contact lens wear and care. To avoid infections, you should clean your contacts at least once every 2 weeks. You should also avoid rubbing your eye with dirty or old makeup brushes. Throw away old and expired cosmetic containers and contact lens cases regularly. If you are an outdoor worker in tropical or subtropical regions, you are at risk for fungal eye infections. They can lead to blindness and loss of vision. Fungal keratitis is a serious condition and is increasing in incidence in countries with moderate climates. A new study aims to identify the dominant filamentous fungi in these countries and determine their susceptibility profiles to various antifungal drugs. Thank you for watching. Please like, comment, and subscribe if this was helpful.